And now I want to go over surfactant administration. So once the physician group has decided to give surfactant, the first dose is 2.5 mLs per kilo. Once that order is put in, we will need to go to the Pyxis, the refrigerator attached to the Pyxis, and get our CuraSurf out. And then we'll want to go ahead and get it drawn up in the syringe as soon as possible. That way the CuraSurf can be warming up before we administer it. Now the CuraSurf will come in bottles like this, and then each bottle has 1.5 mLs in it. So before we draw it up though, this green cap, we have to take it off, and then the metal that's around the top of it, that also comes off. And then there is a rubber stopper at the tip end of it that we pull out. We do not stick a syringe through the rubber stopper to draw up the surfactant, because some of that rubber can get caught in that needle, and we potentially could inadvertently lavage that rubber piece in the airway. So that's why we take the green top off, the metal off, and the rubber stopper completely out, and then we draw up our surfactant that way. So I'm going to go ahead and draw up my surfactant, and we'll say that this baby's 1 kilo. So you see I've got the surfactant bottle here. Of course it doesn't have the surfactant in it, but I do have water in there to pretend. And I'm going to draw up. Each one has 1.5, so if my baby's 1 kilo and we're doing 2.5 mLs per kilo, then I'll need 2 bottles and to draw up 2.5. So I've got 1.5 drawn up, so I need to draw up 1 more ml out of another bottle. And I've got my 2.5 drawn up there, okay? And we get it out of the bottles and into the syringes and in our pocket to warm that surfactant up before we administer it. So I'll hold it in my hand to warm it up, then I'll put it in my pocket to warm it up. But don't mix it, because if we mix it or shake it up, it will just foam up, so don't do that. So I'm gonna warm it up, I'm gonna put it in my pocket. Now, before we administer the surfactant, we always want to suction the patient, because once we've given the surfactant, we do not want to suction the patient for at least an hour. If we can go longer than that, great, but we don't want to suction the patient for at least an hour unless there's an emergent situation that arises. So I'm going to go ahead and suction my patient, and I'm going to line the numbers on my catheter up with my ET tube so I don't go too far. So I'm going to suction, line my numbers up. The numbers are lined up. So I'm going to suction intermittently. I'll pull out within 10 to 15 seconds. Let my patient recover. And anytime that you suction, it's always a good idea to pre-oxygenate with a ventilator. Just hit the O2 button and it will increase your FiO2 20% above what is set. So I've suctioned. I'm letting my patient recover. While my patient's recovering, I'm going to go get my multi-access catheter. I call it the MAC catheter. And this is what we will use to instill the surfactant. And this is what it looks like. Okay. So I'm going to put my syringe that has a surfactant in it. Take this little cap off, screw that off. And my syringe screws right on that. I'm going to take this end off, my catheter right here. Take that off. And then this goes in the same place that your inline suction goes. So I'm going to take my inline suction out and put my MAC catheter there. Okay. Now, before I start instilling the surfactant, I'm going to go ahead and hit O2 breaths, and it will bump my FiO2 up by 20% for 2 minutes. Pre-oxygenate just a little bit. Then I'm going to line my numbers on my catheter up with my ET tube again. Pushing this down, make sure my numbers line up. So I'm going to see over here the 16. I want my 16 lined up. Smaller numbers, small ET tubes will line up with the same way. Okay, I've got my numbers lined up. So now I'm going to instill this surfactant over a minute. Okay, so I'm gradually pushing it in over a minute. And we're doing it slowly so that the surfactant doesn't come back up around the ET tube. But sometimes patients will cough and shoot that surfactant back up the tube. If that happens, just pause, give a couple mandatory breaths on the vent, and then continue administration. And the catheter size that we're using, it's a 5 French, so the ventilator or the NeoT can ventilate the patient while we're doing this. Right now I'm just going to leave them on the ventilator. I'm gradually instilling my surfactant. So let's say that all of a sudden my baby starts to brady and starts to have issues. I'll withdraw my catheter, give a few manual breaths on the vent, let the patient recover. Once the patient's recovered, then I'll put my catheter back down and I'll finish giving that surfactant. Again, as I put my catheter down, I'll line it up with the numbers. There we go. I'll finish instilling my surfactant over a minute. You're doing over a minute again to allow the lungs to absorb it without it pushing back up the ET tube if possible. So now I've given all the surfactant that in my syringe. Now I'm going to unscrew my syringe, draw up 2 mL of air because there's still some surfactant in that catheter and we want to make sure the patient gets all of it. So I drew up 2 mL of air and I'm going to push slowly so the rest of that surf that's left in that catheter will go in the lungs. Okay, I've given all the surf, so now I'm going to withdraw my catheter. We'll take my MAC catheter out and put my inline suction catheter back in. And just remember, once we have given the surfactant, we don't want to suction for at least 1 hour post-surfactant. If there's an emergent situation, of course, do what we need to do to take care of the patient, but if at all possible, do not suction at least an hour after surfactant and longer if possible. Thank you.